the way. So how was it for you?
Okay.
Did you deliver normally?
Uh, no, it was via cesarean.
Were you
Yeah,
induced?
I was induced.
Mhm.
Yes, and I think things didn't go well.
Well, tell us
After 1.5
how was
days,
that for you?
after 1.5 days of laboring, and it's my first baby, so then there was no heartbeat.
Uh-huh.
Then, yeah.
Okay. Um, so you went to hospital because you had contractions, or just tell me exactly what happened. Then I'll know
Okay, for
exactly
me,
how to answer.
okay. For me, I went to the hospital because I was 38 weeks, so it was just a normal checkup. So, and it was a different hospital from the obs guy that I was seeing. So once I arrived there, I had this, I think it was Braxton Hicks. So I had pain every time in the abdomen. And at that point, I felt like I was going to deliver. So I just went to be checked. And the moment I arrived there, I was told I can't go back, that I had infections. I didn't understand most of the things. So then I was told I'll have to be induced. That was the first doctor. The second doctor came and was like, why did you get induced? So there was that confusion. Yeah. So by the time the second doctor was asking me why I got induced, I should have delivered naturally. There was that confusion in me, So it was like I should have stayed at home. I was in a state of confusion because I was having regrets. At the same time, I'm like, I don't know what's happening because I've been scared of that I'm not supposed to have infections. It might affect the baby, so I need to get to be induced, you know. Then that was how now the induction did not go well. I think I was given in form of tablets.
You were drinking or they were being put inside?
They were being injected.
Uh-huh.
Yeah.
And how many were inserted?
Um, I think two. By the time they were to put the third one, the contractions were intense. When they put the first two, I was not having any contractions. And before they could insert the third one, that is when the contraction started. It was intense. Then the baby's heartbeat dropped, and it was nowhere to be found. Then it was an emergency. Yes, right away.
Okay, but when you got home, and rather when they went for CS immediately, they found baby and everything was fine. How's baby now?
Yeah, the baby was fine, but she was not breathing. She was not breathing, and she had jaundice that time. So I saw her for like few minutes. Then she was rushed to the how do
Nursery.
I say? Yes, but she was on oxygen for 8 hours.
Oh, wow. Well, that must have been quite an experience,
I,
that one.
yeah, true.
Okay, okay. Glad to see that you're okay and baby is fine.
Yeah, right now we are fine. We are used to.
Okay. So tell me, what kind of, after all that, what questions on your mind? Let me ask it that way. And hi, Maggie, welcome to the forum. It's Q&A, it's more of a discussion. And then I'll answer questions towards the end.
Okay. The questions that were on my mind that time were like why are these decisions, why are they differing from doctor to doctor? Yet, and this is the last moment, if it were differing from the beginning, it would have been easier for me to take in. But at the last moment that I can't even make any decision on my own, it was a really tough thing. I got confused. Then that is the time, by the time I was coming home, I had like postpartum depression, you know.
Oh, no.
I really, yeah, it was, I didn't know that thing happened until it kind of happened to me. I used to think it was just stories. So that time I was in denial because from someone like me, I didn't want CS from the moment go. I always knew I was not a person for CS.
Mm-hmm.
That was a no. So like coming home and it's an emergency CS, then I'm in pain. I didn't have a house help. You know, that time it's my first baby. I don't know what to do. I'm confused. I'm having this question like, why did I have to go for CS? That time I'm like, God, why didn't you hear my prayers, you know? But then at the same time, I'm like, hi, I would have lost the baby
You
if
stayed with the
maybe the
baby.
yes. So, but for a moment, it was a time of denial. But after some time, like it was understood.
Okay. And baby is 9
Yeah.
months now.
9 months. Then again, that's that time the baby has jaundice. Then that is the first time a pediatrician tells you the baby has jaundice. You're like, okay,
What is
what
that?
is jaundice?
Okay, yeah.
Then you're being discharged. Go home. You'll come after 2 days. So I'm wondering, you've told me a very big term and you're telling me to go home. So I got confused more and more. Yeah.
Okay. Quite the experience. So I'll try and demystify induction. You've brought up postpartum depression and well, neonatal jaundice. I think we can have discussions on that in a later platform, Sindel.
Yeah.
But for induction of labor, it's generally something we do to manually jumpstart your labor. That's exactly what induction of labor means. So it means that for some reason or another, the baby may not be doing well in the abdomen. And so we need to get the baby out as fast as possible. Yes, go put in kitchen. So we need to get the baby out as fast as possible, but still attempt a normal delivery. Yeah. So usually we do it post date. So you have a mom who's gone to term, gone beyond term, and then now not beyond term, but beyond the 1 week after the due date we had given. And we need the baby to come out based on, the fact that we are post the dates. But in some cases, we can do it early. So for example, you're 34 weeks, but your water has broken and you're getting an infection. You get? In that case, we may do an induction of labor. But at the time we're doing the labor to protect baby and you from infection, baby from getting further injury in their abdomen, or rather in the womb. So from what you've mentioned, it could have been something close to that. Although the other factors that we look at, for example, we'll do an ultrasound and see how is baby managing. We'll do, and the serial ultrasound. So for example, if we find that baby's growth is being restricted or is not developing as fast as it ought to, we tend to look at what's going on. So it means that either the placenta is not giving enough food, or there's something in the development of the baby that is not functioning well. So in that case, the baby is better outside the abdomen than inside. Yeah. So in such cases, we will induce or opt to go for a cesarean section based on a case-to-case scenario. For women with diabetes or pregnancy, for example. So there are many cases where we feel like maybe we need to deliver earlier. But generally, we prefer when labor starts on its own or by itself. So we tend to wait until a mother is 40 plus 6 days, unless there's an issue. Yes. And then we also, we've seen that any induction that has happened between 39 and 41 weeks tend to peak well. Beyond 41 weeks, they tend not to do so well. So because of that, we don't do inductions after the 41 weeks, or in most hospitals, they wouldn't. So that said, induction of labor is just ripening of the cervix, yeah? Which means the tablets you are being given, remember you had like 2 tablets and then a third one that was not given because you had already started contracting. The 2 tablets are supposed to make your cervix softer. And then as the cervix is becoming softer, it will initiate some things we call prostaglandins that will initiate mild contractions. So those mild contractions help the cervix dilate, or rather, if you start closed, start opening up slowly. And then as that is happening, the head is also able to calm down. So that's the whole aim of induction, that we soften the cervix, start giving you mild contractions, and that the head starts descending slowly. So immediately we see that you've gotten good contractions, then we stop induction because we have gotten, or we have achieved what we wanted. So had they have given you, for example, a third pessary, then that would have been, it would have sent you to hyperstimulations because now you contract a bit too fast. So you'll notice at that point, many people, or rather many of doctors will break the water and then look at whether the water is doing, whether the baby's water is clear. They will listen to the baby's heartbeat, and then they will monitor the contractions. If everything is going well, then they can put you on a drip or observe your contractions. That drip is the one that most people fear because it gives you contractions continuously. And those contractions are quite painful because, of course, they are contractions of labor. So basically, what we find is that induction is a softening process. And then once you've softened up, now we go to the second step, which you call augmentation. Not every woman who's been induced gets augmented or gets the drip. The drip, watu wanasema ni uchungu, drip ya uchungu. So that we call oxytocin drip. But that drip, the work of it is to maintain contractions at 4 contractions every 10 minutes. Which research has shown that when you have 4 contractions every 10 minutes, then you get a very good time and spacing for the baby to breathe in between the contractions, but adequate contractions enough for you to deliver. So you want them 4 every 10 minutes, lasting about 40 seconds, 30 to 40 seconds. So if we find that we're having that without putting a drip, then we won't put a drip. Yeah. But if we find that we are giving that, and we find that your contractions happening by themselves, but they're not getting to 4 in 10, or the baby is delaying, on a chart that we do, we call a patograph. Then we when we find that, thank you, we find that we are getting to a space where on the patograph, or the chart that we actually use to monitor if your labor is going well, that there's a delay, then we start you on a drip. Okay. Now, in some cases, unfortunately, either because of hyperstimulation from the medication we've given, or the baby was just unable to fit well with the whole labor process, sometimes we find that babies don't tolerate labor well. And that's why in labor, we have to really be keen to see how is baby doing. So in cases where we find that the baby is not doing well, then we stop everything. We stop the pills, we stop the water, which by water I mean the drip, to see if with that baby is going to cope on their own, or if we need to do an emergency cesarean section. So one of the risk factors of doing an induction is that sometimes it fails, or sometimes it acts too much, so that we get a hyperstimulation, and then both ways will end up in cesarean section. So it's because of that that we don't induce every mother. And before we start any induction, we do something we call a Bishop score. So Bishop score tells us if a mom is able to, if we induce, if it's going to give us a good outcome or a poor outcome. So based on that, tells us, do we give more time so that mom goes home and comes back? Or if the situation is dire, then are we going to skip induction altogether and deliver via cesarean section? Or can we buy time and do things that are mechanical? Mechanical induction means either we put a catheter or something we call a sweep. So it's a very painful vaginal examination where the cervix is literally pulled up. It's literally pulled up. So that pulling up, oh God, is usually quite painful, but it's a natural method of trying to help mom get into labor naturally. Okay, so the other methods that we use for induction, which are the tablets that I was talking about. Either we put a tablet inside the vagina or we put it in water and give you to swallow every 2 hours. Or in some places, you'll find they'll have the smaller tablet where they break or they have a smaller formulation and they give you under the tongue. All of those methods have been seen to work, but they are chosen based on case-to-case basis, okay? And then after that, induction with that, or rather augment, you can actually also induce with syntocinon, although it's rarely done unless there's an issue that is forcing us in that direction. But the drip, the oxytocin drip that happens once you reach 4 or 5 or 6 or 7 centimeters, or someone will say, I was 9 centimeters and I was induced. That's called augmentation. So when you are above 6 centimeters, it's no longer an induction because the cervix is already soft, you're already dilated, everything is okay. But maybe the contractions are not adequate enough. So that particular drip usually gives you a very, very strong contractions, which are very painful. But for some people, for some, they feel that it's still okay. It's like the mild cramps or the cramps of the periods. We call them period pains. So that particular drip helps us to give you contractions that are continuous, as I said, so that we aim for that 4 in 10. And that drip, when we start it, we usually monitor your heartbeat at the same time, or the baby's heartbeat at the same time. Because sometimes, again, it can be too much for the baby to cope with, okay? But if you're 7, 8, 9, and we give you the drip, usually you deliver within an hour. So sometimes we allow you to progress on your own, and when you see that things are not working, then and only then do we put the drip. So the drip is not the same as induction of labor, and most people fear that particular drip. In Inviolates' case, for example, yours was purely an induction of labor. There was no drip, it was just the tablets that you were given or the pessaries that were inserted, and then the contractions peaked, but the baby was unable to tolerate for one reason or another, okay? So I think one of the things that I have seen is sometimes it's so painful, and then after that you end up with a cesarean section, you know, or sometimes there's nothing, 3 are put and there's nothing, then you still end up with a cesarean section. So I've seen that particular disgruntlement with many women, but it's one of the risk factors when we are doing an induction of labor. So as you've had, patient choice is very important. It's not everyone who's taken through an emergency, an induction of labor. Now, if at all you've gone through, or rather you've been told to do an induction of labor, have an open mind. It may end up with a normal delivery, which is what we are hopeful for, or it may end up in a cesarean section for the reasons I've stated. And sometimes you could have gone normal, but then the pelvis is too small. or the labor is obstructed because maybe baby positioned their head differently or something like that, or because labor is just prolonged. You've had 3 days of labor or 2 days of labor. So those reasons have nothing to do with the induction, but they are valid reasons to go for a cesarean section. I think with pregnancy and with motherhood, it's important to know the root is not as important as the outcome. A healthy baby is more important than a normal delivery with a poor outcome. So it's an emergency cesarean section because it's an emergency. There's nothing you could have done different in Violet. There's nothing I could have done different. I had a cesarean section, you know. And sometimes having that open mind to know that it can go either way helps us a lot with the guilt afterwards. There's a lot of mom guilt associated with not having a normal delivery, but it shouldn't be the case. We aim for normal deliveries. We want 55% and above of our patients to deliver normally. Before it used to be 80%, but the case has gone lower, rather the threshold has gone lower because of many indications that we have seen. Like now the monitoring is much, much better than it was before. But I hope we all understand, as long as the baby comes out safely, that's what's important. So yeah, thank you. I don't know if there are any other questions. Maggie, Kate, I can see your hand is up. You can ask your question. Inviolate, I hope I've answered the questions.
Yes, thank you.
I'm happy to hear that. Kate, your hand is up. Any question? Oh, that's an accident. I think it may be accidental. Maggie, thank you for joining us. Any questions from you? You can type if you feel that talking may be scary. Any questions from you? Okay. So I'm going to post this on the YouTube channel because we've lost so many people trying to join the live. My apologies for that. I'm still trying to get the hang of that. Thank you, Steve, as well. Thank you, dads, for joining and husbands for joining the session. It really helps when you know your partner is with you up to the very end. So it's wonderful to see a man on board. And we pray to see more of you joining for such sessions to understand pregnancies better. Yeah, Margie, ladies. So thank you for joining us, Steve. I've seen chats. Where are those chats? Where did they go? Lord. I've seen something from Maggie saying very true to that on the chat. Here we go. So no question. Thanks. I've learned a lot. Thank you, Kate, for that. And Maggie saying thank you. Yeah, so grateful for your time. I hope you're going to have a lovely night. And oh, okay. Can't the drip water be painless? Yeah, the drip water tends to be painful based on the threshold of the patient. So some patients have a very high threshold. You may put the drip and they feel close to nothing, or that they'll feel the tightening of the abdomen and then it relaxes, tightening of the abdomen and relaxes. That drip will give you consistent contractions. Like they'll be back to back to back. Okay, by back to back, I mean 4 contractions every 10 minutes. That means 1 contraction every 2 minutes lasting 30 seconds. So if you look at it, that those are very, very many contractions from a human point of view. It shortens, it really shortens the window, but yeah, it can be quite a lot because the power of the uterus is very strong. It's it's a very, very strong muscular organ. So when it pushes or when it contracts with that same power to allow it to push a 4 kg or a 3 kg out of the cervix into the vagina. So you can imagine how much is required for that to happen. So because of that, it tends to be quite a lot. But with a lot of mental preparation, we have breathing exercises, by the way. Please look at your breathing exercises. Excuse my son. Yeah, so please look at your breathing exercises. If you've not yet delivered, breathing exercises help a lot in controlling pain. Things like using a dark room also help in reducing the kind of pain that one feels. Back rubs, the people who feel don't touch me, that's also normal. But having a pregnancy support partner, whether it's your husband or your doula or just someone you trust, your mom, your sister, who can be with you through that, also makes the process simpler. So that's what I would say about that pain threshold. A healthy baby VSS is better than poor outcome from normal. That is true. Thank you, Inviolate. Yeah, so Maggie, thank you so much. This is going to come to an end in a short while. So I pray you've been blessed. Next time I'll be Ali and we'll figure out our technical issues. But be blessed. We really, really appreciate all of you from the Wheels for Life team and Barikiwa. See you in the next video. Thank you. And thank you for sharing, Inviolate. I know it's not easy. Be blessed a million times over. Many women will be blessed because of your willingness to share. So thank you so much. Asante.
Welcome.
Thank you. Asanteni and kwaheri. Good night.